It's my honor to present the data of our latest study, faster acquisition and improved image quality of a T2-weighted Dixon breast MRI at 3T using deep learning, a prospective study performed at the University Hospital in Freiburg, Germany, to you. The objective was to evaluate whether deep learning reconstructed T2-weighted Dixon sequences with super resolution impact acquisition time, quantitative and qualitative image quality characteristics, and diagnostic confidence for cyst and breast cancers in an intra-individual comparison between those two sequences for 3T breast MRI. Deep learning models can assist in diagnostic and segmentation tasks, showing significant improvements in the image quality and acquisition time. Deep learning-based image reconstruction methods have demonstrated to be superior in image quality and maintained or even improved signal-to-noise ratio across various sequence types, anatomical structures, and organ systems. Acquisition times can be reduced by parallel imaging, compressed sensing, or interpolation techniques, and the deep learning-based image reconstruction has been shown to compensate for the lower SNR caused by these techniques, especially parallel imaging techniques achieved by undersampling the case-based data, which allows for fewer iterations and thus faster acquisition. It's a prospective study conducted on 140 participants with a mean age of 54 years, performed on a 3T breast MRI with an 18-channel breast coil. We implemented the conventional T2-weighted Dixon sequence and a prototype deep learning reconstruction sequence with super resolution in a standard breast MRI protocol with contrast agent, and performed it previously to the contrast agent injection. Imaging parameters were set identical for both T2-DL and T2 standard sequence with a TR of 6000 milliseconds, a TE of 101 milliseconds, and a flip angle of 151 degrees. The deep learning reconstruction differed slightly in phase resolution and phase oversampling and have a double as high acceleration factor of 4 compared to 2 for the conventional sequence. Also, the spatial resolution resulted in a 0.3 times 0.3 times 3 mm interpolation spatial resolution, which was doubled. For the quantitative analysis, we performed region of interest measurements for SNR and CNR. For the qualitative analysis, we performed ratings using Likert scales ranging from 0 non-diagnostic to 5 excellent, performed independently by 2 radiologists on diagnostic monitors. We evaluated image quality features such as image quality, artifacts, noise, morphology containing conspicuity, sharpness and margins, and diagnostic confidence for cysts and breast cancers. We also evaluated the reader's preferences for the two sequences in side-by-side comparisons, and inter-reader reliability was also analyzed. Overall, we had 140 images analyzed for quality and 36 patients with a histologically proven breast cancer, 85 patients with cystic lesions. The acquisition time was improved by 58% and 2 minutes 36 was saved. So we had 1 minute 50 for the deep learning sequence and 4 minutes 26 for the standard sequence. The SNR and CNR of breast cancers was significantly higher for the deep learning sequence. And also for breast tissue and fat tissue, the SNR was significantly improved. There were no additional artifacts observed, and motion artifacts occurred less often in the deep learning sequence. Also, subjective noise was lower in the deep learning sequence. The overall image quality was rated higher in the deep learning sequence. Here you see an example of healthy subject with on the left side the standard sequence and on the right side the deep learning sequence with improved sharpness. For example, look at the Cooper ligaments, and you see it's much more clear in the right side image. So you see for all anatomic structures we found that the sharpness was improved. And here you see an example of the nipple, which is quite more sharp on the right side in the deep learning image. And the star marks the higher noise, which you see in the conventional image compared to the deep learning image. Lymph nodes were also visible quite good and improved in the deep learning sequence. On the left side you see a lymph node metastasis, and on the right side a benign lymph node. Different results were observed for bone marrow. Here we found that different signal aspects were not identical, and that the standard sequence had a better image quality and higher sharpness of these lesions. We come to that later. Cystic lesions had an improved lesion conspicuity, improved microstructure margins, and better diagnostic confidence for the readers for the deep learning sequence. This you can see in this image on the left side. You see improved sharpness of this lobulated cystic lesion for the deep learning sequence. For breast cancers, similar results were observed with conspicuity, margins, and microstructure. All those were significantly higher in the deep learning sequence, but diagnostic confidence was improved only for one reader, and there was no difference in the suspicion for malignancy. Here you see an example of an invasive breast cancer, and you can see that compared to the contrast-enhanced subtraction image, the cancer is quite clearly visible also in the T2 sequence and much more sharp, and the microstructure is much higher in the deep learning sequence. Readers significantly preferred the deep learning sequence over the standard sequence in side-by-side comparisons. To conclude, the SNR loss is a disadvantage of the parallel image techniques and was compensated successfully by the deep learning denoising application. This provided a 58% reduction in acquisition time compared to the standard sequence, led to fewer artifacts and less noise, and the reduced acquisition time led to less motion artifacts. We found higher SNR and CNR in the deep learning sequence, and the overall image quality was improved. Additionally, all evaluated anatomic structures were improved in sharpness in the deep learning sequence, despite bone marrow. Bone marrow might be more susceptible for loss of structural details in the deep learning sequence due to its more heterogeneous structure. This could be an effect of the edge enhancement combined with denoising. Consequently, the deep learning sequence does not appear robust for a supplementary assessment of bone marrow pathologies in breast MRI. And in summary, the deep learning sequence is feasible and has the potential to replace conventional T2-weighted sequences for breast MRI examinations. It might be suited for the implementation in abbreviated protocols, and it could improve the availability and effectiveness for dense breast screening. And with that, I would like to end and thank you for watching this video and having interest in that topic. And if you have further questions, don't hesitate to contact me anytime via mail, and I will try to answer the questions which arose. Thank you so much.